Perineal massage is a technique that you or your partner can do in your third trimester to reduce your chances of tearing with a vaginal delivery. It's also thought to reduce the grade of the tear and your likelihood of receiving an episiotomy. It's recommended that perineal massage starts between 33 to 34 weeks of gestation and that it's done daily to every other day at most. To perform perineal massage, you want to start with nice clean hands, washed well with soap and water. You then want to lubricate your thumb. Coconut oil and olive oil work really well for this technique. Sitting on the toilet is usually the best position where you can clear your belly and the bowl gives you space to move around freely. You then want to locate your perineum. The perineal tissue is the area between the vagina and the anus. You want to insert your thumb vaginally till about the first knuckle, and you want to feel an area when you stretch down below that feels like a nice muscle stretch. That should not be painful. If it is quite painful or uncomfortable to start, you can always massage the perineum externally to bring blood flow to the area and relax the pelvic floor a little bit. You can also practice some deep breathing techniques to allow the pelvic floor muscles to relax. Once you're comfortable with finding the area vaginally of the perineum, you want to think of a clock, and the points that you want to focus on are 5 o'clock, 6 o'clock, and 7 o'clock. That means the right of the center, and the left of the center, and all the points in between. You can start by just stretching one of those points and holding for about 15 to 30 seconds, coming off, stretching another point, coming off, stretching another point, and repeating that technique. Or as you get more comfortable with it, you can stretch one side, maintain that stretch, and then just sweep your thumb side to side while maintaining the perineal stretch and hitting all three areas. You can focus a little bit more on the center to really reduce some of that tension. If your partner were to do this for you, the technique is more or less the same, but now you can be in any position that you'd like. So reclined up on a couch or on a bed can feel really comfortable, and your partner will be using their 2 fingers instead of their thumb. So a nice technique for insertion is inserting one finger and then piggybacking the other finger on top, then moving side to side once they're vaginal. Otherwise, they can just use one finger if they have quite big hands or if it feels most comfortable. Enjoy!